Hello, my name is Corey Wilford. I'm the Communications Manager at the Larimer County Department of Health and Environment. Today we're going to do a overview of respiratory illnesses for the 2024-2025 respiratory illness season. I have here our Chief Medical Officer, Dr. Paul Mayer, to provide that update. It's definitely that time of year where people are going to start getting sick with colds, flu, COVID-19, RSV. And so Dr. Mayer has some good information for us to help us stay healthy. So I'll turn it over to you.
Great. Thanks, Corey. So yes, I'm Paul Mayer, Medical Officer for Larimer County Department of Health and Environment, and wanted to give a community update regarding the upcoming respiratory virus season. These predictions come out of the Center for Disease Control in Atlanta, and they're based on what's known about currently circulating viruses and the vaccines we have available. It's important to realize that although last year the CDC was very accurate with their predictions, in any year, if there's a significant mutation of the virus, any of these viruses, really influenza, COVID, or RSV, that can dramatically alter the incidence of any of these diseases. And then next slide. Today, we're going to really focus on three illnesses, COVID-19, influenza, and RSV. First, we'll start with COVID-19. So the Center for Disease Control predicts that our upcoming COVID-19 season will be similar to last year. You may all know that right now we're in the middle of a bit of a COVID wave, but the good news is our hospitalization rates have not increased significantly with this current wave, and we're hoping that will continue. It's important for some context, though, to realize that last year, which was a great improvement on the previous year, still over 70,000 people in the United States died as a direct consequence of COVID-19. So it is still a severe disease and one to take very seriously. The good news is the currently circulating strains of COVID-19 are expected to be covered by the updated vaccines, Pfizer, Moderna, and Novavax. The vaccines this year, similar to previous years, are expected to be particularly helpful at preventing hospitalization and death in high-risk groups, particularly in older age groups. Those vaccines are recommended for everybody 6 months and older, and again, in particular, for folks who are in older age groups. And sorry, Corey, if you can go just back one slide. There you go. Oh, sorry, and then forward just one. Thank you. So for the upcoming flu season, they also, similar to COVID, predict that our upcoming influenza season will be similar to or lower than last year's season. And again, with the warning that if there's a significant mutation in the influenza virus as it circulates around the world and gets to the US, that could change things considerably. And the next slide. Remember that influenza is particularly dangerous for both young children and people over age 65, so people at the two edges of the age spectrum. Vaccination for influenza, just like COVID, is recommended for all those 6 months and over. And the current influenza vaccines are predicted to be within a typical effectiveness range. Usually that range is somewhere between 30 to 50% effectiveness, and it can go as high as 60%. RSV. Similar to influenza and COVID, the CDC is now projecting that our RSV season will be similar to last year. That's actually very good news. You may remember a couple of years ago, we had a particularly severe RSV season with a great number of hospitalizations that significantly strained our hospital systems. So that projection is encouraging. And then next slide. Oh, thanks. Similar to influenza and influenza and COVID, we do now have effective vaccinations for respiratory syncytial virus, or RSV. That vaccine is recommended for everybody age 75 and older. It's recommended for people from age 60 to 75 based on a conversation with your medical provider to see if you're high risk for severe RSV. Severe RSV is especially a risk for folks in typical groups such as people with lung disease, heart disease, diabetes, and people in older age groups. That vaccine is also recommended for pregnant women. When pregnant women are vaccinated, will make antibodies which can cross the placenta and give protection to their newborn babies. There is a monoclonal antibody known as nirsevimab that can be given to infants, and that is also very effective at preventing hospitalization and ICU admission from RSV. When we talk about prevention, it is, of course, more than just vaccination. We learned, I think, especially during COVID, that just basic good health is really important at preventing severe illness. So, good nutrition, regular exercise, getting plenty of sleep, avoiding excess alcohol, those basic measures are very important, in addition, of course, to vaccination. Other preventative measures that we're all aware of, but I think it's worth emphasizing again, is frequent good hand washing, covering your cough and sneezes, making sure, especially when you get home from being out in a public place, the first thing you do when you get home is to wash your hands. That can be very effective. Regarding treatment, remember that we have effective antivirals for both influenza and COVID. So when you get ill, make sure to call your medical provider quickly. Some of those need to be started within just a couple of days of onset of illness to be effective. Return to work guidelines are now much simplified. The CDC has now changed them, so they're really the same across all these illnesses. COVID is no longer separated out for return to work guidelines. These return to work guidelines, though, it's important to remember, are for non-healthcare workers. There are still some unique guidelines for healthcare workers. And the guidelines are to return to normal activities when, for at least 24 hours, your symptoms are improving, and if you had a fever that has been gone without the use of fever-reducing medication. And the fact that symptoms need to be improving is worth emphasizing. I think a lot of people think they can just go back to work 24 hours after the last fever, but it is also important that they are feeling better before they go back to work. We know that many people are still contagious when they do go back to work under these guidelines, so we encourage folks to do additional things such as wearing a mask, watching the social distancing, and being careful about good hygiene when they do return to work. And then last, just some other resources for your attention if you have further questions. Thanks very much.